Hello everyone, Dr. Ryan Shakley, your Annapolis Chiropractor. Today I want to talk about a very commonly misdiagnosed issue or problem that I see in the office. It relates to persistent low back, hip, backside, and thigh pain. And this pain usually occurs during, or especially after activity, or especially during or after sitting. And it's called pelvic instability. And if you have those pains during those times, chances are you probably have that issue. And these problems can go on for days or weeks or months, and in some cases even years. I recently saw that a patient come into the office, and she related to me that she was having those problems during those times in those areas, and that she was looking for help. And she had been through the normal gamut. She went through to her primary doctor, she went to the orthopedist, she went to the physical therapist. Nothing wrong with going to see those guys. They're fantastic at what they do. However, in this case, they missed the issue. They missed the problem. She kept getting diagnosed with piriformis syndrome, and they weren't exactly wrong by diagnosing her with that, because there was pain, there was problem with the piriformis muscle, but they missed the bigger issue. They missed the cause of the problem. What they were tracking down was the symptom. Yes, the muscle, that piriformis muscle, was tight, tender, and sore, but they missed the fact that multiple other muscles around that area were sore as well, and stretching it made it better just very temporarily. And they gave her anti-inflammatories to kind of cut those pains down. But really, over the long term, it allowed her to worsen. She was complaining about having this issue for 10 years. So I asked her, I said, well, what happened 10 years ago? And she said, well, I fell off a bike, landed really hard on my side, and got up and had to walk home. So that's very common with these issues. Usually we'll see some trauma. However, sometimes it can be repetitive in nature from doing something over and over again, causing some damage to that structure down there. But the key was they never really fixed the issue. Why this develops is you get an instability at that SI joint, the sacroiliac joint. And what will happen is, because there's no muscles, it's a ligamentous joint, because there's no big muscles crossing that joint, what the brain will do is it'll start trying to tighten up muscles around that area. So it tightens up everything else around that. So you start getting tight, tenderness, and soreness again in all those other areas that I mentioned. But the problem is there's no big muscles crossing that, so tightening those things up doesn't actually fix the issue. It just causes a lot of pain and discomfort. It's actually more of a ligamentous issue than a muscular issue itself. The question is now, well, okay, doc, we see what's going on, we see what the problem is. How do you fix it? What are you going to do that's different than what everybody else is doing here? It's very simple. I'm going to fix the problem. I'm going to identify the issue. We do that through examination, through x-rays, and obviously during that consult as well, you get a lot of great information during that. We sit down, spend some time with people. Then what you're going to want to do is adjust the misalignment. You look to see, we use those x-rays, we use that exam to identify where those things are out of alignment and causing that problem. You adjust that back into position, and then you support it, because if you just keep adjusting it or you just keep stretching it, you're actually not allowing that joint structure to heal, and those problems are just going to keep coming back over and over and over again, as I mentioned that happened with that one patient. So what we do is then we would then support it. And what we do is we teach them the proper way to sit to support their hips, and also to use a band to help support that hips in many cases as well, support those SI joints, so that they're not constantly wearing back out of position, especially because people are up. You can't just sit at home all day. You have to get out and move around. One common way to, or easy way to identify if you have this issue is just by sitting down. And if it hurts when you're sitting, try to sit like a cowboy. You've seen it in the Westerns where they sit up with their chest to the chair and their legs spread open. What that does, that actually rolls the pelvis underneath, keeps that pelvis in, and your leg bones, your femoral heads come in and actually support that SI joint, support that pelvis, and keep it from flaring out when you sit down, which is very common, especially for ladies that sit with their legs crossed. So if you sit in that position and you notice any kind of a perceivable difference, you've got some sprain strain injury of that SI joint down there, and we need to work on correcting the alignment that's on that side that's the problem. Again, we need to work on adjusting that, getting that line back up, and then supporting it in that position so that it can heal. And that's the great thing about this. Once you kind of identify that problem, you get it working in the right position, you teach somebody how to take care of it, usually in about 4 weeks, they're doing a lot better. Again, it does take some time because you do have some damage to the structure, but it does get better. So I hope you guys found this video helpful today. If you or anybody, any of your loved ones are even possibly suffering from this issue, give us a call. We're here to help. 410-263-4171 is the number at the office. Visit us on the website, www.shakleychiro.com. Make sure that you like or follow us here on Facebook, and also check out our YouTube channel. We have more and more content coming to that all the time, and that's Shakley Chiropractor. Just go on YouTube, and you'll also see the link down at the bottom here. And one more thing, for those people that you do want to send in, if you're having an issue, check the links down below here in the video, and what you're going to see is a special offer for them to help them out on that first visit. Other than that, I hope you guys have a wonderful day, and I'll see you next time.